So, my speech is a little less weighty than the last couple speeches. It's not about saving the world or anything. But when I was really little, my grandma used to say to me, "A penny saved is a penny earned." And I didn't really know what that meant, and I figured it was just like random grandma speak, because she grew up in the Depression and she said all kinds of weird things. I never really thought about it until the last couple years, when I've been in college and other than this semester, I've been taking a minimum of 18, 19 units and working all the time. And I started to get sick a lot more, like just minor little things. And it started costing a lot of money, because having to go to the doctor, having to get medication for whatever it is, or just time lost from school, from work. And it got me thinking I wanted there to be something that I could do that would just make it go away. And being a typical impatient American, I wanted it to be like just a pill that I could take, or something that would just fix everything. And sadly, that doesn't exist. But I did find something that is a lot more enjoyable than taking a pill, at least, and something that I think that you guys should try too. And it's getting regular massage. A lot of people know that massage is relaxing, but most people don't know about the health benefits of massage. According to the National Institute of Health, massage works by decreasing the amount of cortisol in your body, which is produced by stress. And cortisol is a hormone that your body naturally produces that destroys your body's ability to fight off infections or cold or flu or whatever it is that you have. And at the same time, massage also increases the number of lymphocytes in your body, which is the white blood cells. That's what you use to fight off an infection. And it can increase the blood flow to certain parts of your bodies. Now, the most common form of massage that most people know about is relaxation massage. But there are also a lot of other kinds of massage, and massage can be used for a lot of other purposes. According to the Mayo Clinic, common usages for massage other than just relaxation include dealing with anxiety and depression, dealing with chronic pain, sports massage, which is both to prevent injury, and once someone has been injured, it can actually speed up the healing process. It can stimulate infant growth, and certain forms of cancer, massage has been shown to actually help in the treatment of cancer. Now, I've been doing this the last couple of years, and I still get sick sometimes, but not nearly as much as I used to. Although I do get the occasional bout of food poisoning, like last week. I've tried telling this to my friends and giving them this as an idea for what to do, and the two main objections that they usually have is time and money. Well, if you want to look at the time aspect, I'm talking about maybe an hour to an hour and a half every couple of weeks, maybe once a month. And who in this room can honestly say they don't have 1 hour out of the entire month that they could go and spend on making themselves feel better and making themselves more healthy? And as far as the money goes, if you stack up on one hand all of the money that you spend going to the doctor, all the money that you might spend on medications, on time lost from school or from work, and even more money wasted on gimmicks and things that are supposed to be helpful, like people talk about herbal medicine, but you have to really know what you're doing with herbal medicine, otherwise it doesn't really work. You can't just go into a GNC and start pulling bottles off the shelves and like dumping it into your body and hoping, because that's not so effective. So if you stack up all of that on one side with getting a massage every couple weeks, I think it's pretty clear what's going on, and it seems like my grandma was right. A penny saved is a penny earned. Thanks.
Kyle, what did you think?
Like the
first couple minutes into the speech, he kept his hands in his pockets, and when they weren't in his pockets, they were busy playing with his shirt. So, like, sometimes it seemed like he didn't really know what to do with his hands. But he seemed like he was really confident with the knowledge that he knew about massages and everything and how they could help you. But there weren't really any like references on like if it's true or not. And, he could have done some of that, but he had really good eye contact, obviously, because he didn't have anything to read from. But besides that, I thought it was a good speech.
Excuse me, I think I'm working on one more sneeze here. Nope, I guess not. All right. The personal story at the beginning is okay. The connection to the topic needs to be a little bit clearer. I guess I get the idea at the end of the presentation because we're being short-sighted in how we spend our money, and this in the long run would be more productive for us. So, but it seemed a little indirect. I thought that you're very natural when you're talking to us, Yoshi. I mean, you're not having a problem talking to people and relating pretty well, but you do have a couple of those habits I think Kyle was pointing out. You got your hands in your pockets a little, sometimes you're nervously pulling at your shirt, that sort of thing. But your facial expressions, your voice, everything is very fluent, so you've got all of that going for you. Now you just need to add a little bit more content to the speech, because I think you've got the ability to create good credibility here. You've got a nice personal story. You're talking about something that you can relate to. You say you've talked about it with your friends. Let's get some data into this. I don't know what kind of research has been done to suggest that massage is helpful in preventing a variety of illnesses. I'm sure that people who practice this and doctors who recommend it would be able to give you some kind of information on this. What we've got here is very vague. It's very abstract in nature. At one point you mentioned, some cancer claims also, and I'm thinking, okay, we need some data on this, because otherwise people are going to think, well, I'll just prevent cancer by having a massage, and that's not that isn't going to happen. So you've got to be a little bit careful about the claims. It just needs some content development. Structurally, I think you need to be sharper in developing the structure, but the introduction was fine. The delivery was pretty solid, except for the gestures and those things that we were talking about before. All right, I know everybody's impatient, so thank you all. If you did a written evaluation,